So Jeff Sessions, the human Keebler elf, as I like to call him, has decided to hell with all the states that have gotten with the times and legalized marijuana for medical and some for recreational purposes. He cites how marijuana is highly addictive, has no medical uses whatsoever, and I am sitting here as a father here to say to you, Mr. Attorney Jeff Sessions, okay? My daughter, who is on 2 separate seizure medications because of a major foul-up by a military midwife in Landstuhl, Germany. These are 2 very heavy benzodiazepines. Now, I'm getting my notes out here, and I'm going to run down a list of some of the side effects that she has to put up with. First one is Onfi. Clobazam is the technical name for it. Confusion, hallucinations, fever, chills, coughs with yellow or green mucus, feeling short of breath, feeling like you might pass out, pain or burning when you urinate. I'll get to that in a minute. Urinating less than usual or not at all. My daughter has been hospitalized 22 times. 5 times she's literally died and required CPR to be brought back to life. You know what the cause of all of those hospitalizations were? They were all rooted in UTIs, urinary tract infections. Let's go back and look at Onfi here. Urinating less than usual or not at all. So 22 times she's been in the hospital, all because of Onfi, which you, sir, say is medically safe because the pharmaceutical industry says it's safe. Severe skin reaction, fever, sore throat, swelling in your face or tongue, burning in your eyes, skin pain, followed by a red or purple skin rash that spreads especially in the face or upper body and causes blistering and peeling. Guess what we're dealing with now? Drowsiness, dizziness, feeling weak, tired, irritable, slurred speech, loss of balance and coordination. Now, my daughter, her brain injury, she can't speak, she can't walk, she can't talk. Sleep problems, insomnia. My God, what I would give for my daughter to be able to be awake just a little bit more than 5 minutes a day. Because years ago when her Onfi levels were down to a fraction of what they are now, I had a daughter who was pretty lucid. Now, while she couldn't communicate directly with me, she was able to follow me across the room with her eyes. She could respond to my voice, and you could tell she was responding to my voice. Constipation, vomiting, trouble swallowing, mild fever, dry cough. Now the other one, the other one that she's on now is called Fycompa. Psychiatric and behavioral adverse reactions including aggression, hostility, irritability, anger, homicidal ideation, and threats have been reported in patients taking Fycompa. Now, I can't imagine what a kid would be like who only has a seizure disorder and not a major brain injury like my daughter suffered. You call that safe? You think Fycompa is a safe medication? Let's see. These reactions occurred in patients with and without prior psychiatric history, prior aggressive behavior, or something or other, use of medications associated with hostility and aggression. Advise patients and caregivers to contact a health provider immediately if any of these reactions or changes in mood or behavior or personality that are not typical for patients are observed while taking Fycompa or after discontinuing Fycompa. Closely monitor patients, particularly during the triation period and at higher doses. She's 12. Okay? She's on a pretty high dose. Now, cannabinoid oils. They're legal here in North Carolina, and they've been shown to greatly help kids with certain types of seizures. Unfortunately, here in North Carolina, we tried CBD oils for my daughter. There's no help whatsoever on how to wean her down from the nasty benzodiazepines that you, sir, Attorney General Sessions, that you say is safe. But if you do a little bit of research, you'll find in states where marijuana, full-blown marijuana, is legal, there are kids just like mine who benefit greatly from its use. Not from benzodiazepines, which we'll get to some other things here in just a minute. Let's see, how many die due to cigarettes every year and tobacco use? According to your CDC, 480,000. How many die due to alcohol-related deaths? According to your CDC, 88,000. According to drugabuse.gov, 8,000 OD on benzodiazepines every year. Now, I don't have a lot of worry about my daughter overdosing on benzos because she can't get her own medicine. She's completely and totally reliant on her mom and I for her everyday care. And so then I have to ask you, sir, how much money do politicians receive from the tobacco industry? How much money do politicians receive from the alcohol industry? How much money do politicians receive from big pharmaceutical? Billions? Millions? What will it take, sir, for you to stop spouting the same talking points that have been trotted out years before I was ever born, and I'm 44 years old? By the way, how many deaths have been attributed to marijuana? 1. Exactly 1. And if you look a little bit closer into that situation, there was an underlying condition that helped contribute to that, to where doctors who now say, no, it wasn't the marijuana, it was the underlying heart condition. Instead of having a child be as lucid as can be, I have a kid who sleeps 95% of the time. She's barely awake. Her seizure medications have gone up and up and up over the years. If I wanted to try and use real marijuana for my daughter here in North Carolina, I'd be locked up, thrown in prison. All because some millionaire didn't throw a whole bunch of money at politicians to get you heads out of your butts and get with the times. There are thousands of kids like mine who would benefit from marijuana use, from medical marijuana use. But we're denied, we're vilified. People who go around the law, they take their chances. They're imprisoned, all for trying to help their kids. You say benzodiazepines are safe. I just read down a whole bunch of side effects that say otherwise. What's the side effects of marijuana use? Well, what's the side effects of drinking a beer? You decide, sir. You're the Attorney General.